And our focus at the moment is particularly on how we integrate services in the community and surround those services in the community with specialist services provided by our specialist trusts. What we're proposing, well, we're in the process of doing, is getting in place an infrastructure that will support integration, small integrated systems across the whole of Cumbria. We're developing what we call primary care communities, which are services based on populations of anywhere between 15 to 50,000 people. And then from within that community, we're bringing together the GP practice populations and the community services and social care, and also looking at how we can release the community assets within that population. In order to do that, we also need an infrastructure on which to build those integrated services. So across Cumbria, we're looking at the buildings that we have and have we got the appropriate buildings in place? How do we integrate IT just once across Cumbria so we don't try and do it each time? So we have one integrated approach to IT that each of those small integrated systems could use. And then also, how do we have an approach for developing our workforce and developing our organisations that again is accessible to every integrated system, every team really on the ground. We've been at this for a number of years, and during that time there have been ups and downs. And often they've been where the system's been reorganised. So we've been approaching things in trying to integrate, for example, general practice and community services. And we were steaming along on that route, only to have the community services removed at very short notice from the PCT. And we had to find another home for them within a couple of months. That led to a lot of previous work just falling apart. There's then the issue of getting the senior leaders across the whole of Cumbria lined up and agreed on what we're doing, and that's taken some time, and that's actually taken some change in leadership as well. There's been quite a lot of change in leadership in organisations. Relationships have probably been one of the biggest enablers, building the right sort of relationships between particularly both the senior leaders and then on the ground clinicians and teams coming together and having the time to try to talk together and creating the space and time for them to talk together. I think it also has to be said that people often talk about you needing a burning platform in order to make some rapid progress. And we've certainly had that in Cumbria. We've got major problems with both of our large hospital providers have got well publicised problems. We have to focus on measures of success that are firstly are from the patient's perspective. So every time somebody has an appointment and then has to wait 3 months for an investigation, then waits 3 months to see somebody to discuss the result, that's waste. That's from the patient's perspective. It creates anxiety and waste. So if we can get to the position where when we talk to our patients about their experience of the service, they say, it's been fantastic. You know, it's happened by clockwork. It's happened just when I was told it would happen. There's been no duplication. I've not repeated myself. Everybody seems to have known what's gone on when I've been somewhere else before. So I think that's a very, very tangible example of how we will measure success. I think firstly, it's ensuring that all the organisations, like the leaders of the organisations, have a shared vision and there's absolute clarity about what you're trying to achieve. And so that the sign-up is based on real clarity and understanding. Then that vision has to be shared. So I think don't underestimate the amount of time that you have to spend going over that story, that vision. I think it's understanding how you're going to make your first few steps. And we've spent a long time trying to work out what the first few steps are. And sometimes you don't know if you're going to make the right first few steps, but you need to make some, and you need to be fairly clear about what they're going to be.